In this video, I want to talk all things extensor tendonitis. What is extensor tendonitis? Why it might be a condition that you've had and just not realised because it's super common, and ultimately what you can do about it. So, firstly, if you're new to the channel, my name's John. I'm a sports injury therapist and I want to help you to understand your body, get rid of pain and weakness so you can strive forwards and hit your health and well-being goals. Now, what we're going to talk about here is a condition of the foot, a common condition in the foot, and one that affects the top of the foot. So pain in the top of the foot here, and we call this extensor tendonitis. Now, what is this condition? Well, effectively, this is where we have the tendons of the muscles in our shin run through the top of our foot. And if you look at the top of your foot, and particularly if you pull your toes up towards your shins, you might be able to see those tendons running along there. Now, if we get some inflammation or some soreness around those tendons, we can get that pain on the top of our foot. Probably something that you might well have experienced if you've been out running, if you've gone on long walks, where you started to use these muscles a lot. What that can do is cause this pain on the top of the foot. And we term this extensor tendonitis. Now, what I want to do is explain what you can actually do to get rid of that or to prevent it if you just want to stop it happening. But what we need to do, first of all, is not just think of it as a pain at the top of the foot. We need to think of this as a unit, and actually we need to get better biomechanics and systems happening at the ankle joint as a whole. Because the first thing that we can do, of course, is we can treat our symptoms. So if the pain is on the top of the foot, we can look to reduce those symptoms. How can we do that? Well, firstly, we can do it by using things like ice. So if we sore on the top of the area caused by inflammation, we know that ice is going to help to reduce that inflammation, and it's also going to help us to calm down any of that pain and calm down that inflammation so that the symptoms that we experience starts to settle. But we need to think further afield than that. That's kind of like whacking a plug over a leak. We're not actually correcting the cause, and we want to establish what's actually causing that pain in the first place. So we might think, okay, well, if we've got a tendon injury at the top of the foot, let's stretch out the muscles at the that's pulling on that tendon. Something I would typically advise, but here's where we hit a problem. Now, the shin muscles, we can often term, or I might term, a unstretchable. And what I mean by that is the sheer biomechanics or the structure of the ankle means that the shin muscles are near on impossible to stretch. Now, you might be able to see some tibialis anterior stretches out there, but in my opinion, they're very difficult. They put a lot of strain on the ankle. The ankle simply isn't designed to go the other way. So we know that the ankle joint, the muscles on the shin pull it up. So to stretch it, we want to pull it down. But the problem is the ankle joint just doesn't allow enough movement in that phase to get a stretch. So what can we do? Well, this is where things like self-massage can be helpful in that area. And you might have various ways of doing this. You might have a foam roller. Even better than a foam roller, in my opinion, for this is something like a lacrosse ball, a means of really getting into that tissue and looking to roll through. This particular condition is also a really good use of something like a massage gun to be working into that shin area. It's these muscles in the shin pulling on the tendons that are causing the problem. But what we also need to do is think of the back of the ankle as well. And that in particular is where we have our calf complex. Because if we have a lack of movement at the shin, or if we're very particularly tight through that ankle, what might happen is if we're tight in the back, that the front muscles have to be doing more work to drive us forward when we're walking and running. And this extra work that they're doing can start to pull down onto those tendons. So it's really important that we're checking out how much movement we have at the ankle. I'll link to another video at the end of this one that really discusses the importance of this movement, dorsiflexion. But what you want to do is be comparing left to right. And if you've only got the pain in one side, are you restricted in the amount of dorsiflexion that you've got in your ankle? If you are, then what that might mean is that actually that's a contributing factor to why we're getting the pain on the top. So how can you work out your dorsiflexion amount? Well, this is where we use something like a knee to wall test that you can see here, where what we're looking to do is drive the knee over the top of our ankle so that it touches the wall when keeping our heel on the floor. Then effectively what we're looking to try and find is the maximum distance that the foot can come away from the wall and keep the heel on the floor and allow the knee to touch the wall. What you'll find is you'll hit a point where you can't actually keep the heel on the floor and get the knee to touch the wall. That's the maximum distance, and we want to compare that left to right. So if you found that you've got a restriction here, that is a crucial movement that we want to improve. And you can do this with a couple of key stretches that I'll show you here. Firstly, we've got a stretch for our gastrocnemius muscle. This is the main muscle in the calf area, the one that you might think of as your calf. And we want to be holding this stretch for about 30 seconds. But we also don't want to forget the other big player in that calf complex, and that's the soleus muscle. A similar stretch with a key difference. You'll notice here that that back leg is now bent. Still those heels are super glued to the floor. But what we're doing here is stretching out the whole complex. And what we'll find by carrying on these stretches for a period of time, hopefully weeks into months, is that you'll start to improve that amount of dorsiflexion. And if you find that as you improve your dorsiflexion, your symptoms start to settle, then that's a great thing. We know that we're onto a winner here, and I would keep that going. What we also want to make sure that we've got is some strength in our ankles. Because again, if our ankles aren't strong enough, the muscles around the ankle are going to work harder in order to stabilize our ankles. So if we're going out for a run and we think of our feet as our foundation, if you plant that foot on the floor and the ankle's nice and strong, the muscles don't have to work in excess. However, if the ankle's wobbly, our body will compensate to get that stability at the ankle, and it's going to grab those surrounding muscles. And this is where we start to get tight through the shin area, and that then leads down into the tendons of the foot. So simple exercises like standing on one leg and closing your eyes will test some of the stability around that ankle. And what we want to do again is compare left to right hand side, or I should say problematic to non-problematic side. Is one side stronger than the other? And is the weak side the side that you're getting your pain? That straight away gives us some exercises to go at, because by increasing the stability at the ankle, then we know we're going to take some of the pressure away from those surrounding muscles. Another thing that we can look to do is to check the overall strength of this ankle joint and calf complex. So using something like a single leg squat and repeating this exercise 6 times, again on the non-problematic side compared to the problematic side, we can start to see, does this bring us on pain? Or perhaps even more of interest is, do we start to fatigue quickly on the problematic side? Because then we know we're suffering with a lack of strength in that ankle. And again, if we've got a lack of strength, then those muscles are going to tighten up quicker and start to cause pain running down into the foot. So that's some of the key things that you want to be working on. Now again, some of the other factors that come into play around any conditions of the feet, shin area might be if we've suddenly changed our volume. So if we suddenly go to increasing our mileage, increasing our frequency of training, increasing our intensity of training, that's one that can certainly lend itself to some of these shin and foot related conditions. We also want to make sure that we've got the right footwear. We want to make sure that we've not got shoes that are old or actually that are too compressive in that area and compressing those tendons to make them sore. So footwear will always be an important thing to get right in those circumstances. But I hope that's been helpful for you. It's a super common condition, this extensor tendonitis, but it is one that we're able to fix. Firstly, we want to treat the symptoms with our self-massage and our ice into the area, but then we want to find out the cause. We want to be finding out the stability of the ankle, the strength of the ankle, and ultimately the amount of movement that we've got available at our ankle. So using our stretches, using our balance exercises, and using our strength exercises, such as those single leg calf raises, can be really helpful in doing that. Has this been helpful for you? If it's been helpful and you've made it this far through the video, well, that's awesome. Smash that like button to show me that you've done just that. And whilst you're smashing that like button, slide on next to it and hit that subscribe button if you haven't already, because then I will take you into our community and keep you up to date as soon as we drop our next video. Speaking of another video, here's another one all about that ankle dorsiflexion if you want to dive into that in more detail, and I'll see you on the next one.